I'm the director of Autumn Institute of Health, and I want to welcome Josephine. Josephine will be doing a workshop for us or with us in 2 weeks. So on October 28th to 29th on a topic called the three-legged vessel. We're very excited about that. And we thought it would be a real nice thing. Or Josephine had the idea of doing a little talk to just kind of open the door to these topics. The specific topic being, what is classical Chinese medicine thinking? How is that thinking different from what we may have learned in our undergraduate programs or what other schools of medicine might be using? And then we'll be going, or she'll be going deep into that topic and exploring that and all the different clinical applications, or at least a handful of the clinical applications in the three-legged vessel workshop in a couple of weeks. Um, Josephine is from North Carolina, which is where half my family's from. So I spent a lot of time down there. So I forget if we talked about that. Um, but yes, she's from North Carolina, so she's up here, Nova Scotia, every now and then. And I'm very happy to be able to grab you while you're up here and host you at the school. It's very exciting, and I think from the conversations we've had, the way that you work and the way that you think about the medicine aligns a lot with my own practice, as well as the vision I have for Autumn, and how we are the kinds of practitioners that we are trying to cultivate and support. Um, so thank you for coming. Thank you for doing this. And with that, I'll leave it over to you.
Thank you. Well, thank you for having me. I love having the opportunity to talk about Chinese medicine pretty much any time, I have to say. And today was very interesting when I sat down to put this together. Usually I just write little bullet points, but a whole lot poured out. So I can tell that things have been brewing inside me. And I do want to say right at the outset, I don't consider myself a scholar. I'm not a translator or a scholar. Um, I think of myself as a very diligent apprentice, a very devoted student. And I'm always looking to understand the nature of things. And I really believe that is the tradition. You know, the tradition of all of the classics of Chinese medicine is sitting down and looking at the way things are and trying to understand how they work in yourself and in whoever you might be working with. And if I was going to just make a nutshell about classical thinking or classical Chinese medicine, and a lot of times I like to leave the word Chinese out of it because it's really just medicine we're talking about. The key is what I like to call the view, right? The view is what it's like the roof of the house, and the foundation is knowing how to apply it, actually. So the classical view is simply that you can know the world by knowing yourself, basically. And that is what led people to create the Huangdi Neijing, which many of you might know. The Yellow Emperor's Classic is a conversation. So the other piece of classical thinking is that you're never out of relationship as long as you're alive. You're in relationship. So a key sort of one of the, you could say, the pillar that holds up the roof is qi, right? And qi is basically a relationship. So as long as you stay in relationship, you can hold the view and also make practical choices about what you do with somebody or with yourself. And also, when the classics were written, and for me, and I'm not going to say this is for everybody because it isn't, people have very different ideas about what should be considered classics. So I don't want to argue about that with anybody, but for me, I consider the classics at least 1,000 years old. So all the Wenbing, all the Ming Dynasty, Imperial Dynasty, Imperial College formulas, all of that. It's only 500 years old. So for me, it doesn't fall into the classics. And And what I notice about the classics, the Huangdi Neijing, the Nanjing, and something like the Shanghan Lun, is that they're based on a conversation. They're based on a relationship. In the case of the Huangdi Neijing, it's explicit. It's actually written as a conversation. And in the case of the Nanjing, it's a commentary on that conversation. And in the case of the Shanghan Lun, it's a conversation with nature and the body. So for me, that's the core of that kind of thinking, that we know the view and we understand where the connection comes from. What are we connected to in any given moment, right? And the other piece of that, the tradition, is that in those times, people were invited to read the writing and then to contemplate it and then to try it, just to put it into practice for themselves. That was the method, right? We might call that apprenticeship. And even in this day and age, you could still view yourself in that relationship if you wish. And from my point of view, that is the clinical relationship, that you are an apprentice to the body, period, whether that be the body of your own experience or the body of somebody else that you're working with. And when you think of it that way, it does invade your life on every level, speaking from experience, because you begin to see everything around you in these amazing relationships that begin to inform you, right? Because once you understand what's in relationship, there's this flow of information. And I call that flow of information the power of your own perception, right? Because we all have the gear, so to speak. We all have eyes, ears, nose, mouth, and the ability to use those things. So for me, the application of the classical way is to actually use your own perception, not to use. So one of your perceptions is your intelligence, by the way, and that intelligence is a combination. It's not just book knowledge, right? It's experience and book knowledge. They both contribute to what we call your intelligence. And so the beauty of that is that intelligence is never ever anywhere else. It's always right here. You're never without it, and it's always available to you. And it doesn't matter how much of it you have, because you can use what you have anytime, any place. So to me, the really exciting thing about having that view is that you're never without tools. And it doesn't matter what tool you use. If you use it in connection, if you use it in relationship, then it will be powerful. You could know very little, just like Henry was saying. Somebody could just be studying for 4 weeks, but that doesn't mean they don't know anything, because they have a body and they've had one since they were born. So they have a lot of information if they are connected to that body. And that is how Chinese medicine developed. People being in their bodies and contemplating what that meant and what that felt like and how did it work. And I guess, like you can tell, I get very excited because it's everywhere. It's everywhere you look. And so you're not without a huge well of information, or you could say experience and information together all the time, yin and yang, all the time. And one of the phrases from my teacher that I love to remind people of is that it's only ever 50% morphology, the body you have, and 50% cosmology to make up the 100%, right? So there is always, you have yourself and then you have the world around you, both of which are providing opportunity to connect. And the reason I think this matters so much in terms of our practice is that you can't, and funny enough, this is true. When I sat down to put these notes together, I didn't know how it was going to relate to the three-legged vessel, but it did somewhere in the middle of here. It connected. So the thing about the three-legged vessel, I'm going to talk a lot about the three times, past, present, and future. But the thing that's critical is that you can't treat the past, it's not happening. You can't treat the future, it's not happening. You can only treat the present. And the only way you can treat the present is to actually be present in your body to what is present and know what that is. So that's consistent with that view when you apply it. And when you read those texts, when you read the Huangdi Neijing and you contemplate what it is they're trying to talk about, they're always trying to talk about that vital relationship between the spirit and the body, right? The yin and the yang. And so they're always talking about that integration, that relationship. And for me, that is the place I always return to, because there is where we can connect with anyone, anytime, any place, right? Because we all share Big Shen, we all share air, and we can't make that stop. So it means that we both feel others suffering, and it means that we also feel all the ways that we can be of benefit when we connect. So it works really well when you're willing. And of course, willingness is the also one of the other pillars in the house, right? Willingness to experience what's happening, because a lot of times, and I don't want to, I don't in any way want to knock allopathic medicine, because there's a time and a place to use a remedy that will make someone's life easier in the moment. But the issue is that when we choose that over the larger experience, we miss the things that might need to be tended to prevent disease, right? We miss things that, it's like a little treasure hunt when you use allopathic modality, which for anyone who doesn't know what I mean, I just mean treating symptoms, right? I mean treating things in a sort of, it's sort of like walking in a random line around the room. Like, well, what can I do with that? And what can I do with that? And how can I stop that? And how can I make that go away? And when you do that, it's very easy to get lost in the forest, right? It's a little bit, the word I use is squirmy. You know, it kind of squirms right out of your grasp. You think you've got it, and then it's you can't figure out what happened. So when you use the view and the way that I would suggest you think about things, in this kind of what is present here now, what might I wish to avoid, and how did this get here? When you think in this way, you will have a lot of ways to know whether what you're doing is actually working or not, and what happens when it doesn't. You know, or if it does, why did it work, right? So you follow your own knowing in that way, and then you gain confidence and power in your own practice. So many people in the classical, you know, in the tradition, probably, I don't know, up until 100 years ago, up until maybe even less than that, 60 years ago, apprenticeship was the way. Probably more like 100, right? Now, people go, in China anyway, they go to school for 7 years. They go to school and they learn Chinese medicine and Western medicine together, and they do rotations in the hospital where, you know, sometimes they're in the Chinese wing and sometimes they're in the Western wing. But 1,000 years ago and more, it was very typical for people never to quote unquote graduate, that they were in apprenticeship for their whole life because it was not considered a bad thing to be. They were learning on the job all the time, and they thought of themselves as being um, learning from their own experience as well as learning from someone else's experience the whole time. They never it was a collegial, shall we say, like they were happy together. They weren't trying to go somewhere else in a way. And I think that's the other piece of this way of thinking that I think is so beautiful, is that when we think in this way, we are caring for the whole package without worrying about whether we get to be the star of the show, as happens a lot sometimes. And I would say that I feel like the this kind of approach is very humbling when you really explore what's happening for people, and when you really listen in and are willing to feel what they feel. It changes things a lot, for how we are uh, both instrumental in helping people, but also how we simply provide the space for them to see their own capacity, their own healing, which does happen um, too. And the last 50 to 100 years in Chinese medicine has mostly been about making recipe books, right? Making a prescription for a headache, for example, or for a backache, or uh, whatever. And the problem isn't that those prescriptions aren't useful. It's that we don't understand why they work or why they don't work for us. And sometimes it is true that points, some points will work well for you and not work well for you because you're you. So it's not always just about the patient. Sometimes it's about your connection to your own um, gifts and your own experience. So just like people have, I don't know, maybe you don't know this, I know this, but most of us who've been practicing for a long time, we have our favorite points and our favorite herbs. I'm probably notorious for saying they're all my favorite points when I'm teaching people because they become my favorite point at that moment. But we're all like that. We all have points we like and points we don't like, and herbs we like and herbs we don't like, and it's all great because it isn't when you're not dependent on the recipe, you can use what you know works for you. And anyway, that is the reason I think it matters so much to learn to use what worked for you, because we aren't encouraged, when we learn all of the recipes, we're encouraged to memorize the recipes. And memorization is a beautiful thing, but it's not the same thing as knowing what works for you, and or the meaning of the things that you see and know in the room at that moment when you're creating a treatment, right? The meaning of what they are to this person and to yourself, because that will affect the efficacy and power of your treatment from this point of view. And again, I'm not trying to say that that everybody should practice from my point of view, but only to say that I think I have I'm inspired to encourage people to use their own knowing, because frequently, especially in the clinic, people use prescriptions that they've never used before, nor have they seen anyone use them. And then when they don't do what they want them to do, they feel unhappy and confused and disturbed. And I often find that really the problem wasn't with their diagnosis. The problem was with the application, because they didn't understand how the points worked with their diagnosis, because they followed the recipe, right, in the book. And so I'm not saying we shouldn't read books either, none of that. I love books. Um, but but in the clinic, I think that your own knowing and perception is so much more powerful um, in terms of creating treatments. So, um, yeah. Anyway, I think I didn't say what I wrote down here. Well, but I am gonna review it for a second and see if there's things that I want to say that I didn't say, and you can anybody can pipe in anytime.
That description of not your treatment not working because you don't connect with the formula or the prescription resonates with me a lot when I graduated from school. And acupuncture wasn't so much for me. It was okay with acupuncture, but with herbs, like it just I eventually basically stopped using herbs. I trained in herbs and I don't really use them anymore because they just never really worked that well for me. I just never really understood them, uh, and I I'm thinking now maybe it's this of what you're saying that I just never had enough time with the herbs themselves or the right teacher to kind of show me the characters of each herbs and to really go in depth to understand how a formula is put together, to understand the principles. I learned in the standard TCM model of like, here's the pattern, symptom, 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 use this formula. Why that formula? Oh, because this herb treats this symptom, and this herb treats this symptom, and blah, blah, blah. And
Right.
it just never, like, I didn't understand the deeper context to it. Um, yeah, so
Yeah,
I
you
think
don't get
that's
it. You don't get it in most schools at all. And um, yes, that's true. And just to say, you actually don't need more than one modality in which you specialize, right? It, they overlap, and TCM is really big on that overlap. But the truth is, you could be just an acupuncturist, you can be just an herbalist, you can just use stones, you can use massage, you can use qigong. Each of them are actually standalone modalities because they all follow the view. Therefore,
mm,
you do not need more than one, actually. And again, this is just the way I was taught. This is Jeffrey Yuen's approach to. He says this a lot. We of course we learn all these different modalities, but they all share the view. We all share the strategy of uh, holding the view. Um, and so it doesn't matter in that way. But it is also true that when you learn from somebody who has a deep connection to them, each of those modalities has a different character, and some you may resonate with more than others. I came into Chinese medicine doing herbs. I was most interested in herbs. I didn't want to do acupuncture at all. But it's amazing how they get to you after a lot of years. They do worm their way in those points. And I had to laugh. I gave myself a little treatment this afternoon, and it's a big change to go from the mountains to the sea level. I think it's affected my fluid systems. And anyway, so acupuncture is great for that. Yeah. Yeah. I think the main thing is to encourage people to use what they do resonate with, for sure, and to understand that the recipes, I mean, they're well intentioned, but if you compare it to cooking, for example, if you decide to cook and you go to your refrigerator and you just take out whatever you see and then you throw it all together, it may taste great and it might taste terrible, but you don't really know until it's done. Whereas, you know, when you look at this recipe that somebody gave you, if you've made this before or you know what you're dealing with in terms of the ingredients, then you can choose wisely what you want to use or how you want to modify. And I mean, that is the other thing that I want to uh, say is that, classical thinking, there was no patent medicine back then. See, patent medicine started with the Imperial College, and uh yes, volume was their, they were addressing the volume of things. And in classical thinking, we address the quality more than the quantity, right? So that's a very old priority. The priority, and it's old for your body too. I'm just, I can't keep, I can't keep myself in separate boxes anymore. So I won't. For your body will conserve that precious essence, right? That precious quality that is you. That is its job, to keep the essence alive in you. And so the same is true in the classical thinking. The preference is on quality over quantity. And to really understand why you use what you do, then you don't have to worry about it being enough. It's always enough. It's the quality of it that makes the impact rather than the quantity. And in herbal medicine, that does get a little tricky, and I have all kinds of things to say about that. But because sometimes quantity is called for, but not always, and knowing when and how, makes a difference. But yeah. So the other piece that the effort to standardize treatments, which was made for good reason, right? I don't criticize why we try to make patents medicines, but the truth is they will always have a problem, and that problem is that they cannot adapt, they cannot be flexible, and flexibility is the hallmark of good health, right? Flexibility and resilience are vital to anybody's health. So when you use patent medicine, whether it be a recipe for an acupuncture prescription or it be a recipe with herbs or anything, there will always be a gap. It will always have a gap. It's like trying to put it onto your body. It's going to be a certain shape, and your body is its own shape. So it will always hold its shape. That's its job, right? That's the medicine's, especially plant medicine, right? Needles are a little bit more flexible because they are receptive to your technique, but an herb it's an herb. It has its power, its knowing, its experience, and it will perform based on that, and it will have a relationship with whatever you put it with, and it will make that relationship. So um so for me, Chinese medicine is never patent medicine. In in and if you're going to use patent medicines, you're going to use them in a customized way, which a lot of people try to do, which is to put formulas together. Helps if you really understand what you're doing, because formulas do not work like pharmaceuticals. Again, this is our Western minds, and it's good to remember the mindset that classical thinking came of a culture that did not have that. So they didn't have that's just not how they operated. They operated based on incident and experience and awakeness, being aware of what was happening. They had to, they didn't have a choice. So it's very different where we think, there's always a pill. If something didn't work, we'll use that. We can fall back on that in a way in our thinking because of our culture, because of what it's like now in the world. Um, to really go, you could say, to really go old school, to really go to that classical way of thinking, and Jeffrey has over the years, Jeffrey has invited us many times to do this with herbs and with stones and with essential oils and with points to experience each and every one of them as an individual itself, and to make the relationship with each and every one of them as your own relationship. And then you can make that relationship with the point to someone else. But if you haven't made a relationship with it in yourself, you can't do it, right? But that's based on this idea that the medicine grows out of your relationship with yourself and with each of the modalities as an individual exploration that you're willing to make, right? You're willing to read the text, you're willing to think about it, you're willing to try to employ the method, right? And when you do that, you develop this whole living body of experience and wisdom that nobody else has and nobody else needs, but you do. and the people who come to you do, right? So yeah, that lack of flexibility you see, with pharmaceuticals as well as patent prescriptions, obviously. But it's more pronounced with pharmaceuticals because they are not formulas, right? So formulas, because they are more than one thing together, they can take a slightly more movable shape, right? It's like the difference between a basket and a stick, right? A pharmaceutical is a stick and a formula is a basket. And it might be the right basket or it might be the wrong basket, but it will be a certain size or in a certain shape. And the stick, it's very narrow and it will definitely do the job sometimes, but it will also have a kickback, right? When you go one direction, the body is you know the body is going to respond. So uh the same is true when you create treatments. Of course, if you push the body one way, you're going to get a response. That's the nature of it. um and you want to be clear on, if you're going to do that, on what you're doing, um especially if it doesn't go where you think it should go. then you really want to be clear on why that is the case, right? You know that's how we learn. But yeah, I wrote down this Chinese proverb because it's one I love. um I think I shared it with Henry. To be uncertain is uncomfortable, to be certain is ridiculous. This is the thing in our culture. To be uncertain is considered bad business, bad way to behave. But actually, and I say this because I think maybe students or people who are just beginning are here, that to be uncertain is to be authentic, is to be present, is to be real, because most of the time you are. And that's true. And the other thing that's true is that things will change. Whether that change is due to you or not, you have to be able to look at that objectively. You have to be willing to look at that with some equanimity, with some presence, because not all changes are due to you. So when your patient comes back and says, those herbs you gave me, they made me sick, I invite you to be skeptical of that. And when they come back and say, those herbs you gave me, they made me well, I invite you to be skeptical of that, to actually hold the space for your own knowing, which might say, as I do sometimes when people say those, I thought that was great, especially when they have a great treatment. I'm always going to hold the space for, I don't know what's going to happen next time I see them. I don't know where they're going to be, right? I don't own that as my victory or my achievement, nor do I own the um uh shame or despise myself when things don't go the way I thought they might, right? This is just good basic practice with your own heart and soul, that you're not responsible for everything. You're only responsible for the things that you choose to be responsible for, right? So it's good to choose wisely. And really and truly, that changes the relationship in such an amazing way, right? When you begin to choose what you want to be responsible for in the situation, and especially when you're starting out, it's huge. And being willing to be uncertain, to not know. I can't tell you how much you will find out when you are willing to not know. When you listen to those pulses and you don't know, I said this to Henry too when we talked, it's, I don't care what you call it. When you listen to the pulses, you listen. You listen, you receive information. You are yin at that moment. You are receiving. Listen, listen, because what you learn will not be words. You're not listening to language. You're listening to the pulse. So what you learn will not be in English. Doesn't have to be in English. It has to be in you. And then whatever you decide to do with it will be appropriate, will be on point, no pun intended. So, right? Yeah.
We were just having that conversation last night in the teaching clinic where, as I said at the beginning, right now what's happening is I will treat some patients. I take the pulse, I do the treatments, and then we and the students talk about it. And I have that challenge of having to kind of describe what I am feeling in the pulse. And, good 50% of the time, it is really, really hard to do that. To really accurate. I have to kind of fit it into these little boxes, words that seem to kind of convey what I'm feeling a little bit. But you're always shaving off the edges of what you're really feeling in those moments when you're trying to use words to describe it. It's really quite a challenge for me as a teacher to try to convey to these students who are trying to learn the pulse and learn, what means what and what am I seeing in the patients and all that stuff. Try to convey to them this very, almost non-rational experience that happens in
Yeah.
taking pulse, right? Because it's just, like you meant, it's just direct experience. There's, it's outside of theory, it's outside of language.
Right.
It just is what it is.
But it's full of all kinds of information for you, and
It is. It's meaningful, very meaningful. Mm-hmm.
meaningful, exactly. And you don't, well, so I'm going to say something probably rather heretical, but you don't need the pulse. You need to take the pulse, but you do not need the pulse to create a powerful treatment. You need to hear the pulse. You need to let it come into your awareness. And if you use the thinking that I'm proposing, you will still create a beautiful treatment without having to name or pass the test on the pulse, right? And so, I mean, school is tricky this way, uh, but it is my clearly my heart's desire to really encourage people to enter that liminal space, because it is where the points live, it is where your knowing lives, it is where the treatment comes from. And I always say to people when I make treatments, I never know when I start out where I'm going. I have ideas, but when I touch the pulse, it drops away and I begin a whole different dance. So you can't, you can put a book on somebody, you can. I don't know, that that is for me not a living medicine, right? That's a static medicine, and the world isn't static and people aren't static, and so a static medicine has limits. And this is really our conundrum, right? That the static medicine is what uh, is glorified here in our culture, right? If it's this, you do this. It's very static and it's very narrow. And the problem with narrow medicine is that it will not meet the times as they are, right? The times are full of change and turbulence, and we we have the skills to meet that in this medicine. We absolutely have the skills to meet what arises. And I don't believe that patent medicines have those skills. I just don't. I think they will find their limit. And certainly in the last 3 years, we have seen that quite a bit, right? They will find their limit, those medicines that are static. And that is because life is not static. And Chinese medicine is built on the idea of change. It's built on the ongoing changing relationship between yin and yang, and therefore it can meet anything. And it will never be you can't beat it. You can't get past it. You can't get past that Tai Chi. There's nothing outside of it. So yeah, be encouraged to use this medicine to meet whatever arises in that way, I'd say. And it is, to me, it's just awesome. I have to say that even after what will now be, I got my NCCAOM certificate in 1994. My number is 296. Right. So I still think that yin and yang are the most amazing thing there ever is to talk about. I still think that that is the secret of life, is in understanding or being willing to be with that mysterious dance that's going on all the time, right? And obviously I still love to talk about it, which is kind of crazy, but it's the way it goes, right?
I find this idea of static medicine versus medicine for change, I guess dynamic medicine, really interesting. And it made me think, I wonder if that's part of what's going on in folks who, prescription, like, pharmaceutical medicine being static medicine, this medicine that comes in, it does one thing really powerfully, really specifically. But in these people who end up, over the course of their lifetime, the number of pharmaceuticals they're taking just keeps growing and growing and growing, right? Because, they have, at one point in their life, they kind of have one thing wrong. Maybe it's high blood pressure or whatever, and then they get that one. And then their body changes, and the doctor goes, oh, no, you're changing. Add on another one. And it just more and more and more. So the more complex their health gets, the bigger their medicine gets, the more intense and longer that list of medicine gets. And I always love the fact that in East Asian medicine, and maybe I think this is particularly true of classical medicine, is the more complex it gets, the simpler your treatment gets, right? The more things going on in the patient, the smaller and smaller your work is, right? It's like looking at Zhang Zhongjing's formulas that are, the Shang
Right.
Hanlin formulas that are just like smaller and smaller and smaller. There's 2 herb formulas, 3 herb formulas, and that is like the pinnacle of genius
It's
in herbal
beautiful.
medicine.
Yeah, exactly. So simple can understand complicated. Complicated cannot understand simple. This is a fact, right? So yes, and you will see many herb formulas just like that. Just like the table of pharmaceuticals, we have herb formulas that look like that, and they are
Mm-hmm.
like, unwieldy, and um, and you don't know what's doing what, and you can't figure it out, and it's problematic. And to me, that is just the result of trying to put a living, breathing, dynamic individual into a box that doesn't change. Because the pharmaceutical medicine, it's at a dosage that doesn't change day after day after day, but you change every day. So ultimately, there's going to be a mismatch in that, right? And it has its place and it has its use, but you have to understand how it works for it to be used appropriately, used properly. And again, not to say that I don't work with people who are using pharmaceuticals. I do, and I always try to understand them energetically, and to understand what I'm dealing with. It helps me to be realistic about what can happen in a situation, which is very important for your skills as a clinician. It's very important to understand what you're capable of doing and what you're not, and how you understand prognosis. Because what I find, a lot of people in Chinese medicine are very unwilling to acknowledge their limit, and therefore create unrealistic expectations, and therefore create disappointment in their patients. And it's not necessary to do that. If you understand how it works, then you can make good prognosis, and you can make realistic um, agreements with people about what's needed. And I think that's very important, because I mean, I could go into the principles behind that, which I do in the three-legged vessel, which we talk a lot about timing and frequency and dosage and all of those things, because they all fall into the considerations for where you place, you see and hear and feel in the conversation with the particular case. So, but since we're getting to the end of our hour.
Does anybody have any questions or anything they want to share or bring up for Josephine?
Can you tell us a little bit more about the course, the three-legged vessel, just to give us a bit more of a taster before?
Oh, well, it is the application of the view to the primary channels. So we're gonna look at a method that I developed on the ground in the clinic for mostly thinking about where it is right now, where it came from, and where it's going, and using what you know to design treatments with that knowledge. And yeah, what else can I say about it? I guess I think that everything I've been talking about will probably show up in there in the form of looking at recipes, looking at points, looking at the different ways that we work with the body, and thinking about the relationship of the primary channels to the other channel systems in the body. That's another piece of what I would share with people. The classical view sees the body in 5 layers, actually 3 layers with 5 channel systems. And so those 3 layers are your relationship with the world, your relationship with your postnatal life, and your relationship with your prenatal life, right? So there's 3 layers: your your outer level, you could say, your inner, your yin level, your yin qi, and your yuan qi, your relationship with your essence. So when you frame you can see, we'll be looking at the circulation of the primary channels. You can see the channel systems on each layer and how it works, which is really fun. And then using the 5 elements, using those that view of the primary channel system in those layers, and thinking about how to make treatments that reflect that understanding, which in my experience, it's fun and easy and therefore very satisfying, and also very effective. And especially I use this method all the time to simplify cases. So another piece of classical thinking on the primary channels is that we only ever use three channels, not five, not six, three. So you simplify your that's why it's called the three-legged vessel. So aside from past, present, and future, and weighing, and you there's all kinds of threes. And three is the number for change. So that's why it's very important. And so we'll explore all of those things, and we'll do cases and play with those beautiful primary channels that are so accessible, right? So of the 5-channel systems, the primary channels are the most accessible and the most used all the time, right? And if you think about, sometimes I think about it like, where do you want to meet somebody? Do you want to meet them in a cafe? Do you want to meet them in a hotel? Do you want to meet them in the police station? You know, where do you want to meet them, right? And the primary channels are kind of like your best and favorite cafe. They're easy to meet people there. Lots of people go there. Everybody knows where it is. It's, you know, it's very nice that way. Thank you for asking.
Any other questions or thoughts anybody want to share? I love the emphasis. Oh, sorry, somebody else.
Go ahead. No, go ahead.
Oh, yes, yeah, okay. I love the emphasis on the future, or the equal weighting of future, because I think both in our fields, many of us in our field, as well as in other medical fields, we spend a lot of time talking about the past, your medical history, what happened up until now, right? You go deep into that. We spend a fair bit of time talking about the present, describe how it feels to you now, and hopefully spend a lot of time doing that. But rarely do we think much about the future. Where is this going, and how do we think about it? And I know, when I was in school, we didn't really learn anything about prognosis, like how to talk to patients about prognosis, how to plan out in that way, how to assess prognosis, like to figure out, is this going to be easier? Is this going to be hard, right? Is this going to take one treatment, or is it going to take 30 treatments? I think, I don't think my experience in that is unique at all. I think many of us really lose the future because it's maybe the most difficult piece to get at. It's not a simple question. You can't ask the patient, how long do you think it's going to take to get better? But it is, as you say, I think it's a really vital part of practice in getting patients to be with you on that journey, to buy in and say, like, yeah, all right, let's do this. I'm on board with what you have, what we're doing together. And like you say, being realistic and trying to give them hope, but not too much hope, or not shutting them down. Like I've been trying to fumble through those kinds of conversations for a decade, and that those I find are some of the most difficult parts of the clinical reasoning of how do I decide, or how do I think about where this is going, and how do I talk to my patient about where our treatment is going and what to expect or what not to expect, or
Right.
I think it's a real challenge.
Well, so this is where the famous quote from the Huangdi Neijing, right? The superior physician prevents disease. The mediocre physician treats the disease before it is evident, and the inferior physician treats the full-blown disease. Now, our problem is that people don't usually come to us before they're in the full-blown disease, because they don't know to. But this is why we have to help them understand. This is why making the relationship changes everything, because then people will be willing to tell you all kinds of things, and you can educate them about, for example, when it crosses your mind that you might be getting sick. That's the time to actually take the medicine, not until your nose is running, right? So we have to exemplify that in our thinking. Therefore, then they learn, and we can teach them, right? Yes, we will definitely be talking about prognosis. It's huge. I agree that it is a big deficit, and it's a deficit all around. And it's a huge topic, because the reason we don't talk about it is that it's people are afraid. And when you live in a fear-driven culture, it's you're not supposed to push on people's fear. So they're afraid about what might happen. So they don't want to talk about what might happen. But you, as the clinician, you are obligated. That is your job. The superior clinician prevents disease, right? That's your job. That's the way I look at it. It's your job to know, where is this going to go? And if, in Chinese, in the classics, right, the I Ching is, I think I mentioned this to Henry when we talked. It's hard for me to keep the I Ching out of it, because the I Ching is a discourse on yin and yang. If you want to understand how something will develop, you should look at the hexagrams, because they exactly, explicitly explain how will yang and yin develop in this situation. It's explicit. So all the ways in which it could happen. And it's amazing, because it's an extraordinary teaching text in that way. And anyway, I have a whole course on the I Ching and the essential oils, which is hopefully going to come out in a book form someday. But
That sounds amazing. I'm excited for that. That sounds really
yeah, yeah, it's but anyhow, yes, prognosis, it's good. We will talk about it.
wonderful. And the last thing I'll say about the three-legged vessel is to bring cases. I have
Yes.
a couple cases that I would love to bring if
Yeah.
I can
Great.
impose my role on that. And anybody else who wants to participate, bring some cases, because that's where it all happens, right? Where it gets really juicy and we get to explore it
Does.
in all the different real world situations.
And it's so
That's
fun.
great.
Yeah. Great.
Wonderful. All right, so we're just past 8 o'clock now. So we'll close. I want to say thank you, Josephine. Really
You.
appreciate you coming in. Yeah, I'm realizing now. I see Eddie. Eddie is just jumping in. Some of the folks on American time, on Eastern Standard
Right.
Time, they might be arriving now at what is
Yeah.
7 p.m. for
I
them.
didn't realize it was Atlantic time.
Yeah, so we might have a time issue there. But we'll for anybody who missed it, especially for the time change, we will post the video online, and yeah, it'll
Yeah,
be
or
there.
will you send it to folks because they signed up with their email, right?
Yeah. That's what I'll do. Yeah, I'll
Yeah.
email it out to everybody, so you'll
Great.
have access to that. I'll figure out where to host it.
Great.
So that's wonderful. Thank you, Josephine. Really appreciate you taking the time and just chatting with
Pleasure.
us and sharing your wonderful ideas and experience. And I'm very excited for your workshop. Um,
Excited too.
so great.
All right.
Um, Wonderful. Everybody have a great night. If anybody wants to reach out to me for the workshop or for anything else we're doing at Autumn, you can get in touch at autumnhealth.org. That's wonderful. Okay. Thank you all for coming. Thank you for showing up. Thank you, Josephine. Everybody have a good night.
Bye.